When personal protective equipment, or PPE, is available through the usual supply chain channels, facilities and those who work in healthcare should always use it in a conventional or routine way. PPE, along with good hand hygiene, is the best protection for you, your patients, and others against spreading germs. When used correctly, PPE acts as a barrier for germs, like bacteria and viruses that are carried in blood, body fluids, air, on the skin or in the mouth, in the nose and eyes, or in the environment. In this video, we will focus on the conventional or routine use of PPE, where PPE is worn and then discarded, or fully cleaned and disinfected after each use. We like to call this one and done. We will also highlight the right time and the safest way to put on or don the correct PPE. The most common types of PPE in healthcare are for hands, the body or clothes, the respiratory system, and the eyes. Using gloves protects and helps keep germs from spreading from your hands to other people or surfaces. The routine use of gloves doesn't mean you have to wear them with every patient. Instead, the Centers for Disease Control and Prevention and the Iowa Department of Health and Human Services recommend wearing gloves when you might touch one or more of the following when working with a patient. Remember, wearing gloves is never a substitute for good hand hygiene. Always clean your hands before donning or putting on gloves. Carefully doff or remove and discard used gloves after caring for a patient. Then clean your hands again.
One and done.
Alcohol-based hand sanitizer is generally preferred over soap and water when practicing hand hygiene, except when hands are visibly dirty. When cleaning your hands, be careful to clean all areas, including thumbs, fingertips, and between fingers.
Body protection during routine PPE use means wearing a gown. Gowns protect your clothing from contamination. When you doff and dispose of your gown properly, either in the garbage if it's disposable or in the laundry hamper if it's reusable, you protect yourself and others by preventing the spread of germs from one patient care area to the next. You should wear a gown when there's a risk of splashes or sprays getting on your clothes or when you're caring for patients with certain illnesses. When a gown is needed, it should be donned before entering a patient's room and doffed and properly disposed of before exiting the care area to keep germs or infections from spreading.
One and done. When it comes to routine PPE use for protecting the lungs and airways, different levels of masks and respirators are recommended for different situations. The type of mask and how it is worn depends on whether respiratory protection or source control is the goal. Wearing a well-fitting surgical or face mask to reduce the spread of germs from your mouth and nose to others is source control. When using a mask for source control, it can be used for an entire shift unless the mask becomes soiled, damaged, or hard to breathe through.
Hold on, that's not one and done.
No, it's not. Just wait. Using a new NIOSH-approved N95 or higher respirator for respiratory protection is the recommended routine use during certain procedures or when caring for patients with certain diseases like measles. Using an N95 respirator as respiratory protection protects the wearer. The respirator should fit the face of the person using it and have a tight seal to the face. Using a respirator that does not fit or is not worn properly can put the person wearing it at risk. Ask your employer about their respiratory protection program and how you can be fit tested for the correct respirator if you perform duties that could put you at risk. For routine use, the respirator should be donned before a new patient encounter and doffed and disposed of when leaving that patient's care area.
One and done.
Now there it is.
The routine use of PPE for eye protection takes the form of goggles or a face shield. Correctly fitted goggles with anti-fog coating offer good eye protection from splashes, sprays, and respiratory droplets. Droplets in the air can carry germs, which can enter a person's body through their tear ducts and cause the person to become sick. Regular eyeglasses are not enough for eye protection, as they have gaps between the glasses and the face and do not offer protection on the sides. Face shields address these gaps by helping protect the eyes as well as the front and sides of the face. Some types of eye protection are reusable. When that's the case, they should be cleaned and disinfected following the manufacturer's instructions before they're used again. Cleaning and disinfecting them correctly before reuse qualifies for being
one and done.
Each healthcare worker should use their own eye protection that fits them. No sharing, as that can spread germs. Is routine use of PPE an expensive waste when equipment may not be visibly dirty? No. You should always assume that any PPE that has been used with a patient is dirty. If it's single use, discard it right away. If it's reusable, clean and disinfect it prior to reuse, following the manufacturer's guidelines and instructions. If it's not labeled as reusable, reusing it does not follow the one and done method. Lastly, the one and done method makes medical and financial sense. Each year, infections that could have possibly been avoided result in early deaths and lost productivity, costing society $12.4 billion and the U.S. hospital system $28.4 billion. The routine use of PPE is the best way for you, your patients, and your coworkers to stay safe. So always remember,
One and done.